Great. Dr. A, do we have another question? Nope. Oh, we're good? Okay. And so then I would like to ask if you have an example of a hospital perhaps that is using your technology and the kind of observations they've made, or perhaps financial gain that
Sure.
was related to being able to find the things you have. I'm
Mhm.
sure that's incredible.
Well, again, what we find is being able to find it is only part of the story. Being able to find it and understand its status is really the key. So we have a number of hospitals who have deployed our system to track relatively expensive devices like infusion pumps. There are many, many of those in a hospital. They're on wheels. Hospitals have quite an investment in those, and we had one of the hospitals, actually one of the earliest hospitals to deployed our system ahead of a major pump purchase. They had planned to roll over their fleet of pumps, buy new ones, and what they did was they tagged their existing pump inventory and tracked their utilization. Again, the status tag that I was mentioning, and that allowed them to understand, on average, how many infusion pumps were ready for use at any point in time, how many were in use, and how many needed to be cleaned. From that data, they decided that they had way too many pumps. In this case, they decided at least 20% too many. And they used that data to buy 20% fewer. And they deployed those in exactly the same fashion, tagged them, and tracked their status. Sure enough, they had more than enough pump availability, and yet had bought, in this case, I think about 53 fewer of them. And that move alone allowed them to save enough money to pay for the system. So they were able to pay themselves back inside of about 5 months.
So the pump manufacturers don't like you very much.
Well, think of it this way. So this would be a positive thing for pump manufacturers. Since we know where the pumps are all the time, we can help a hospital achieve 100% reliability on their preventive maintenance schedules, because they can always find the pumps. Some of these smarter pumps actually have an update service that allows them to download drug interaction data and some other things over the Wi-Fi networks. The challenge, though, is, as we talked earlier, the hoarding behavior. So you've got your favorite pump, you stick it in the closet, you unplug it, it powers down, it can't be updated, and it can't be found. So if we tag a pump, we can always find them. We can always ensure that they're updated. So from the point of view of quality control, these things are always maintained, they're always clean, and they're always updated. That's a good thing, even for the manufacturers.
Now, I think one of the challenges is that you said it's important not just to know where your stuff is, but if it works, right? Basically,
Sure.
how do you know if it works? I mean, doesn't that depend on the the user inputting that information, and whether they do that is a bit of an issue. I wonder if that's a problem.
Well, there are some challenges with input. We can tell you where a pump is. We can tell you with the use of a status indicator whether it's in use. We can, through inference, tell you that it had been maintained properly. We can, through the combination of location and the update service I mentioned, we can tell you that it had been updated. So we can tell you many, many things on an automated basis. On the other hand, we are dependent sometimes on input from others, and we're only as good as the process we put in place to do that.
Right, right. Now, other than the pumps, what other items do you think are perfect examples of needing your technology?
Well, you'd be amazed at how inventive people get, but some obvious ones are wheelchairs and other transportation devices. You need to know where that wheelchair is to pick up the next patient. We've got a tag, actually we'll be introducing this summer, that'll tell you not only where that chair is, but whether or not there's someone in it. So you can always locate that tough-to-find bariatric chair or that tough-to-find bariatric stretcher. That's an obvious use of our technology. We've had some hospitals do some tricky things. For instance, one hospital had trouble with what retailers call shrinkage, theft. And what was happening is people were taking items and putting them in the dumpster during the day, and then when they got off work, they'd go to the dumpster, pick up what they'd taken, and walk away with it. So we put some of our infrastructure next to the dumpster, and guess what? They don't lose them anymore.
Wow.
Telemetry devices are small, they're expensive, they frequently either walk out the door or, interestingly, often get rolled up in the bed linens and washed. And when they're washed, they're destroyed. So we put our reading infrastructure in the laundries and wind up understanding when we've got a telemetry unit before we wash it.
It's the little things.
Well, you'd be amazed. We've one client is using tags on their security guards in the evenings. In the security business, one of the adages is the enemy of security is boredom. So what they do is they have their security guards walk a different route every night, and they use our tagging infrastructure to make sure that they do.
Wow, there's so many applications. We have another question for you from Twitter.
Actually, we have a couple of questions. One is, where are you based out of? And the second one is, we have viewers from around the world here, in Europe and in India. They were very excited about this product. I'm wondering if you have, if you ship or international with your product.
The first question is, where are we? We're
Easy one, right? I bet
exactly.
You know do you know the answer to that one?
I do.
This is a softball question here.
We're just outside of Raleigh, North Carolina, in the Research Triangle Park area.
Okay, great.
So with regard to international, so I'll be quite honest with you. We've been so well greeted with our product in the United States that we have been running flat out to please the clientele here. But we do have plans on going international. It will take, I would guess that would be about a 2011 early project for us.
But if they ask nicely, could they get some of your product early? I mean, if they're ready to go, they want to buy your technology. What's the barrier? I don't understand.
Well, there is an invention barrier or a regulatory barrier. For instance, in Europe, our infrastructure is designed to run in the 900 megahertz band. That's a wavelength of the radio frequency band. That band is designed to do certain things for us, but long story short, it's ideal for tracking things and people in an environment with lots of people in it. People to certain bandwidths actually look like big bags of water to radio in certain bandwidths, and at certain other bandwidths they don't. Our bandwidth is actually not very affected by people. So 900 megahertz is where we broadcast in the United States. We also have infrastructure that's designed to read those radio waves by plugging into an outlet and sitting on that outlet and reading these radio waves. It's a wonderful installation. It's easy as all get out for a hospital to do it in the United States. Let's pause there. Let's go to Europe. Let's go to the UK. The UK has a different outlet. So we would have to redesign our readers, as we call them, to sit on those outlets. That'd be easy enough to do, but it would take a little time to do. The other issue is we'd have to broadcast on a slightly different band there. It's called the 866 band. It would have many of the same properties as the 900, but it's a little bit different band, so we would have to re-architect our product to do that. We'll probably do that, but it would just take a little time to do that. In Canada, we're fine, and most of Latin America, we're fine. But
I'm from Canada. You didn't know that. We're fine in Canada. That's good.
Well, I got to tell you, I'm actually have spent a great deal of my life in Pittsburgh, so I had mixed feelings last night in the Canadian-U.S. game. On the one hand, we lost. You won.
Yes, we did. We won. Say it again.
Our boy won for you. So
that's right. Terrific. Okay, Dr. A, anything else we got there? Nope. All right. Well, Mike, so just to wrap up, perhaps tell me what you think is most important for our audience to know about you.
Well, we can do some exciting things. We can save hospitals real money, we can save nurses real time, and we can enhance patient care all at the same time.
Fabulous. Thank you so much for being with us. Let's give a shout out one more time to where people can find information about you, perhaps your web address, any email if you want to share that, or if you're too afraid, I understand.
www.radarfine.com or mike@radarfine.com.
Thank you, Mike. I hope you get an influx of email. We'll find you. Okay, thanks for being with us today.
You bet. Thanks.
Okay, we'll be back in 10 minutes. Thanks for joining us, everyone.